Hi, everyone. Thank you for joining our afternoon session here. Mike and I have some really exciting things we want to share with you about what our two organizations have been working on in blockchain technology. So, diving into it, I want to give you all an introduction on Change Healthcare and what we've been doing with blockchain technology for the past year. I think it was a year ago that our CEO, Neil Dickersenzo, was on stage and made the statement that it was time for enterprise healthcare companies to look at production goals for blockchain technology, and I'm going to share what we've done to make headway on that. But Change Healthcare, for those of you that don't know, we're one of the largest independent healthcare technology companies in the country. Our network and our software and analytics business covers a wide breadth of healthcare software and services. Our intelligent healthcare network canvasses 2/3 of the nation's insurance claims, and 1 in 5 patient records. And with that level of scale and experience, we're able to bring blockchain technology to the healthcare industry in a really high impact way. And as we have looked at the technology in the last year, we've realized that when you're talking about this tech, you really have to divide it into solutions that are healthcare end user facing. Healthcare's end users are providers, payers, patients. And then you have to think about blockchain from an infrastructure perspective. So since joining the company a year ago, I've helped us kind of divide our solution focus into 3 areas that we think blockchain can provide unique value to. And that's divided across financial, clinical, and engagement solutions. And in each of those, you can think of the blockchain as being able to provide that distributed ledger platform, digital identity capabilities, digital assets, smart contracts. But with each of those solutions, there's a vertical context that's very specific to how patients, providers, and payers are going to collaborate around digital assets. And we've been doing a lot of work to provide more clarity into how blockchain can be applied within each of those verticals. So since we were here a year ago, we were able to bring blockchain into production with our intelligent healthcare network. The very first product that we were able to release, we announced in January actually, which is a Hyperledger Fabric-based blockchain network that runs in parallel to our intelligent healthcare network. Today it's running with the full force of our insurance transactions that come off the Assurance Reimbursement Manager product. And it is capturing 30 plus distinct life cycle events. So our provider customers who use Assurance are able to access this blockchain via API. They're able to see their claims life cycle events as they come off of our clearinghouse, as the payers send their transactions back through the clearinghouse. And it's the first step really towards providing scalable enterprise-grade blockchain infrastructure to healthcare. What we had to look into was, can blockchains really scale to meet the transactional demands of healthcare's use cases when we're talking about trillions of transactions, 300 million people. And for a company like Change Healthcare, that was the very first thing we had to test for this technology in order to bring it to our customers. So I'm excited to share that the solution is running in production, and we've made a lot of progress to go beyond just providing the network and looking into the 3 vertical solution areas that we're continuing to invest in, and then the enterprise development tools that we're looking to bring to market, which brings me to our partnership with TIBCO. And I'd like to introduce Mike Myburgh, who's going to share more about TIBCO's blockchain program and their investment in the technology too.
Good afternoon, everybody. I work for a company called TIBCO Software. I don't know how many of you have actually heard about TIBCO, but TIBCO is an integration company that's 25 plus years old. We specialize in two different things at a high level. The one is interconnect everything, which means is that we integrate systems, applications, devices to create new solutions based on applications, based on processes and APIs that you can then use to actually create innovative new technologies and solutions around blockchain and Internet of Things. So it is a very, very powerful integration layer that helps you internally in your organization get your systems talking to each other. Now, Change Health is using a lot of these technologies in ours today. On a different level, we also help customers to augment all their data with the intelligence that we provide you with a visual way to interact with data. We provide you the ability to, in real time, access data through streaming analytics. And we also actually help you to embed analytics inside of applications in your organization. So it's a very powerful set of applications and functionality that could be used to actually create new innovative ways to perform the day-to-day things. And then, of course, also to interact with your blockchain technology that you are looking at right now. So when we look at blockchain, there's a couple of things that you need to consider and think about that is very different from the way that we do things today. First of all, how do we get data out of the blockchain? Because the blockchain is in, the way that we store data in the blockchain is so different from relational databases. The only way to get the data out is via APIs or via the specific way that the blockchain provides that information to you. So that is where TIBCO can help you to actually get the data out and to make reasonable sense with that data. Eventually, you are, as an organization, probably going to take part in multiple blockchain platforms because you have different business partners that will be part of different ecosystems of different technologies. So you need to be able to get different blockchain solutions talking to each other, and that's where the integration helps you out. To manage your solution, you need to be able to visualize the data that sits in the blockchain. Our visual analytics capabilities provide that information out of the blockchain to visualize in real time what it is that is going on in my blockchain technology itself. So from an integration perspective, when you look at a blockchain, there's multiple levels of technologies that is available and that you need to use to actually create complete solutions. Starting from the bottom, you've got your API layer that sits on top of your actual blockchain. And then, of course, you need to be able to execute smart contracts. That is what we are here to talk about today, and I'll mention that in a minute. But that smart contracts is the business rules that will execute the decisioning based on events inside of your organization when you actually implement a blockchain solution. I talked about the analytics a little bit. I talked about the integration that we can now expose the functionality sitting in the blockchain through our API layer to the people and the consumers of that technology. And of course, sometimes you have off-chain data and off-chain storage that you need to be able to access from a blockchain, because in reality, you cannot store all that data inside of the blockchain data store. Some of that data needs to be outside. So this is just one example of what I use to actually create a visual analytic based on data in real time in a supply chain example, where you can now track the transactions, you can actually track the locations where a package is in a supply chain, and then you can visually represent that. And that is very tough today if you don't have the right visual capabilities as part of your solution. We just announced at our user conference in September 2 new solutions. The one is Audit Safe. Audit Safe is a way to actually capture audit events and then to write that to a blockchain where you can see the provenance, where you can secure those events. But what this allows you to do is to actually connect your existing applications that you have to a blockchain backend. So you don't have to revamp your entire environment, your applications to actually be talking to a blockchain. You can actually plug this in because it's got an API layer that helps you to talk to the backend. So now you can actually embed your transactions in a blockchain that is secured by the blockchain backend.
Yeah. So what we're here today to share with you guys is Change Healthcare and TIBCO partnering to collaborate around one of TIBCO's other blockchain solutions, Project Dovetail. And what we're really trying to do is bring the first smart contract platform to healthcare. One of the things that Change has seen in the last 2 years as we've been working with this technology is that it's very difficult to advance the application development in healthcare when everybody's starting from the ground and having to build up. And most of healthcare's engineers are application developers, coders, they build integrations. And what we see is an opportunity to build development tools that allow for healthcare's engineers to quickly develop and design blockchain applications and provide some portability. So today, Change Healthcare and TIBCO announced our initiative to combine the power of Project Dovetail, which Mike will share with you guys, and Change Healthcare's Intelligent Healthcare Network. What we're doing is bringing the expertise that Change Healthcare has in the healthcare industry to the best-in-class technology solutions that TIBCO is providing for enterprise blockchain development. And this is going to be a platform that is built by healthcare developers for healthcare developers, where we're leveraging the libraries of healthcare integrations and data models that are going to be required to build smart contract applications. And the agnosticism of Project Dovetail, the ability to deploy the solution in any cloud, the ability to develop adapters with any blockchain protocol, to write your smart contract code in whatever language you use and generate that code for the protocol that you're looking to speak to. That versatility is going to enable our healthcare end users to protect their investment in blockchain technology and leverage their existing investments in the infrastructure that they are using today. And also excitingly, Project Dovetail is an open source project, and it's going to be a highly extensible solution for healthcare engineers to continue to develop the features and capabilities that they need to always be on the cutting edge of smart contract design. So we're really excited about this collaboration. We think working together, we'll be able to bring smart contracts into a true enterprise setting using TIBCO's integration capabilities and Change Healthcare's expansive healthcare network. So I'm going to turn it over to Mike to share more details about how Dovetail works.
Cool. Thanks, Emily. So as Emily said, it is a platform-neutral environment. So the thing is, today we have multiple different blockchain platforms out there. There are three major ones that we know of, which is Hyperledger, Ethereum, as well as Corda. And as you are aware, there's a lot of research being done on this technology today. So as a company, we've always been technology agnostic. So we want to allow you to use our technology to actually deploy on multiple backends. And that's why the platform neutral is so important. Because all the blockchain technologies out there today work so differently, for everybody to get to know exactly how this works, to actually be able to create smart contracts, is very tough. Today we know there's about 14 jobs, and there's only one resource to cover 14 jobs out there. So first of all, resources are very scarce, and of course they are very expensive. So with this technology, we want to provide you the ability to model your smart contract, and by modeling smart contracts, we give the business audience the ability to partake in this creation of your smart contracts, where the technology today is so specific and so complicated at some level. We want to bring that up and allow people to discuss and to collaboratively create blockchain solutions. That's why the modeling aspect is so powerful. So with this, we also will provide the tools where you can deploy and manage your deployment on the blockchain itself. And as a user, you don't know or don't need to know about the actual technical background or the platform that you are using. So we are targeting today two different blockchain technologies, and one is Hyperledger Fabric and the other one is Corda. And soon to follow, we will add more and more as we go on. The reason we're doing this is the three major ones, as I said, is very different. Their programming languages are so different. The ways their engines works is so different. There's a lot of technical stuff on the board there, but all I wanted to say really about this is that to create a solution and then deploy on a blockchain, you basically create your own lock-in if you actually design for specific blockchain like Hyperledger or Ethereum. So we want to allow you to change your mind if you need to actually deploy that same smart contract to another platform. And that is very, very powerful. So we actually allow you not to be locked into a specific technology itself. These are some screenshots of how you would model a process and how you would basically drag and drop and link the data elements from triggering a new smart contract. You can actually take that data elements, you can link it up with what is required in the smart contract, and at the end of the day, you can then pass out the actual results. But this, as you can see, is model-driven. You will model the actual smart contract that you will then deploy to the actual backend that you need to deploy it to. As Emily said, it's open source, so it will allow the community to actually collaboratively together build and enhance the solution. Like blockchain technology in general today is mostly gaining from that, making it open source and helping everybody to create new solutions together.
So combined with the extensive and versatile capabilities of Dovetail, Change Healthcare sees a huge opportunity to bring this platform to our healthcare developers as well as the developers at our customers. Change Healthcare's intelligent healthcare network is pretty pervasive in the healthcare industry today. I mentioned that we cover 2/3 of healthcare insurance transactions. We touch 1 in 5 patient records. We're talking at the scale of 12 to 13 trillion transactions a year happening on our intelligent healthcare network. And in the past year, as I've talked to startups and enterprise companies about what they would seek in blockchain collaboration with Change Healthcare, they've been pretty consistent that they are interested in accessing our network and harnessing the power of our network to build next generation applications in insurance, records management, patient engagement. And we see a really huge opportunity to enable that. But there's a strong path for us to provide end-to-end solutions for our customers. But one of the things that's so exciting about blockchain technology is its ability to allow a community to grow on the network and develop its own solutions, and the blockchain being able to support competition of solutions. And we see an opportunity for our customers to take a hand in that development and in that design. And for anyone who's worked with smart contracts before, you might be familiar with how challenging that can be. They're very nuanced technologies. It can be very difficult to know how your code is going to execute. And it can be difficult to sell it. If you're an engineer, it can be difficult to sell this to the business because the word smart contract is quite confusing. And it's hard for the business to really understand the process architecture that's taking place. So one of the cool things that we saw when we were first introduced to Dovetail is the ability to visualize the steps that the steps that would go into a smart contract, the ability to contain jobs and activities in a way that can be dragged and dropped into a workflow and then published as chain code. And we think that visibility is really going to help bridge the conversations between the technologists and the business and allow them to collaborate more easily around this very inclusive development experience. Another component that we think is going to be very interesting for healthcare's engineers is the fact that this is an agnostic and versatile solution. Healthcare information systems are pretty diverse. They run on a variety of cloud environments. They use a variety of standards and integrations, and it's just not feasible to build a competitive ecosystem with one infrastructure. And we see the need for our customers to be able to be adaptable and for the solutions that they invest in to be portable. And those features are what really attracted us to Dovetail as a smart contract platform. Added to that, the inclination towards Hyperledger and the fact that it's already an open source platform, that really lends itself well to the spirit of the technology and where the future is really heading with healthcare application design. So we're really excited about where this can go, and some of the verticals that we're looking to apply it to include claims administration, records management, and patient engagement solutions. as I mentioned. So, we're really eager to share those ideas with you and to hear how you would want to apply those using the intelligent healthcare network and the smart contract capabilities that Dovetail can support. We do have a few minutes left here on the clock, so I'm happy to open the floor to questions if we're able to do that. So fire away if you guys have them.
Yes.
Hey, Mel. So the question is, have we learned something through this process that translates well to other business processes? And one thing that we've learned in working with smart contracts and since Change Healthcare has been involved with blockchain technology is that smart contracts are not, a full replacement for business agreements that have to take place between companies. In fact, that's not really what they're designed to be. They're operating instructions for the blockchain. And that means that the applications that connect to the blockchain need to ensure relative consistency in how they do the same functions, such as creating an identity or registering a piece of information on the blockchain network. If you have multiple applications communicating with the same system, you want to ensure that there's consistency and compatibility in how they do that, which is actually pretty difficult to pull off from a design perspective. And so we see the value in having a system that provides a consistent user experience for our customers, but also can provide a consistent or predictable execution experience as they design their smart contracts and want the behaviors that they're testing in their environment to behave predictably in their partner's environment. Okay, well, we really appreciate you guys coming out to hear our presentation, and we would love to invite you to come to our booth. Change Healthcare and TIBCO are exhibiting next to each other in the Innovation Hall. We're happy to answer more questions about where we're taking this platform and what's next for both companies. So thank you.
Thank you.